Most people with alcohol use disorder will achieve remission, meaning they no longer meet criteria for active illness. A study of people who met criteria for alcohol use disorder found that a year later, only 1/3 still had active alcohol use disorder. Hi, I'm Dr. Sarah Wakeman. I'm a general internist and addiction medicine specialist at Mass General and medical director for substance use disorders at Mass General Brigham. I'm an associate professor of medicine at Harvard Medical School, and this is Fact Check Alcohol. Fact check. Alcohol use disorder only affects people of certain age groups. This is false. Alcohol use disorder is when someone uses alcohol in a compulsive way, has lost control over their use, and continues to drink despite having negative consequences, for example, on relationships, health, or roles and responsibilities. Alcohol use disorder is incredibly common. Based on national survey data, nearly 30% of people at some point in their lives will meet criteria for an alcohol use disorder. In 2020, more than 28 million Americans had an alcohol use disorder. While the highest rates are among people in their 20s, alcohol use disorder can affect people at any age. For example, 1 in 10 people between the ages of 45 and 64 have a current alcohol use disorder, and more than 2% of people over 65. Fact check. Alcohol use disorder is a choice. This is false. Most Americans use alcohol, and thankfully, most don't ever develop an alcohol use disorder. The risk of developing an alcohol use disorder, like other health conditions such as diabetes, is due to exposures, genetics, and environment. It is not something that a person chooses to have happen. No one chooses to lose control over their alcohol use or to suffer from negative consequences on their health and life. That would be like saying someone chooses to develop type 2 diabetes because they ate a lot of sugar. Many of us choose to eat sugar and processed food, but no one chooses to develop diabetes. Fact check. People who suffer from alcohol use disorder have to hit rock bottom to get better. This is false. This is a common myth that people with alcohol use disorder must hit bottom before they engage in treatment or get well. This is a ridiculous way to frame and to dehumanize people with a health condition. Imagine if we said that people with high blood pressure must have a stroke before they are ready to start treatment. Not only does this approach result in horrible outcomes, like people dying from liver disease before ever being offered treatment, but it also shows just how deep our stigma and misunderstanding as a society is for alcohol use disorder as compared to other health conditions. All of us, healthcare providers, family members, and friends, should be actively trying to raise the bottom and partner with people with alcohol use disorder to get effective care as early as possible. Fact check. The type of alcohol determines the severity of the addiction. This is false. A standard drink is a standard drink. One 4 to 5 ounce glass of wine is the same as a 12-ounce regular beer or 1.5 ounces of 80 proof liquor. Our bodies process alcohol in the same way regardless of the source. Fact check. Once a person develops alcohol use disorder, they will always struggle with it. This is false. Most people with alcohol use disorder will achieve remission, meaning they no longer meet criteria for active illness. A study of people who met criteria for alcohol use disorder found that a year later, only 1/3 still had active alcohol use disorder. Fact check. I can just quit alcohol without getting help. This is true and false. This one depends. Some people, especially those with mild alcohol use disorder, may be able to resolve their problems related to alcohol use on their own. However, people with more severe forms of alcohol use disorder often require treatment, either with medications and/or behavioral therapies and other supports. The most important thing to know is that there are effective treatments out there and they are vastly underused. Fact check. People with alcohol use disorder need tough love. Helping them just enables them. This is false. This is a terribly harmful myth. The definition of addiction is compulsively using a substance despite negative consequences. And we know using alcohol can be a powerful coping mechanism in times of stress. How would making someone's life harder, making them feel unloved or unsupported or unworthy, help them get better? Fact check. Alcohol use disorder only affects the individuals who suffer from it. This is false. Alcohol use disorder can impact the family and friends too, and it can be helpful and important for loved ones to learn about alcohol use disorder so that they can support the person struggling and also take care of themselves. There is a very successful model called Community Reinforcement and Family Training, or CRAFT, that teaches family members about addiction and strategies to positively reinforce healthy behaviors in their loved one, to help their loved one identify their own reasons for wanting to change, to use positive communication, and to practice self-care. This approach has been shown in studies to be incredibly effective. Fact check. Someone with an alcohol use disorder can just walk in for treatment and get help. This is true. Across Mass General Brigham, we have bridge clinics, which are walk-in, drop-in, easy access care models, so that people who have a substance use disorder can immediately start life-saving treatment, cared for by a team of addiction specialists who treat them with compassion and dignity. For far too long, addiction treatment has been difficult and complicated to access. At Mass General Brigham, we are working to ensure treatment is accessible, equitable, and immediately available. Thanks for watching. Don't forget to subscribe to Mass General Brigham for more videos on substance use.